Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. Aparna sat across my desk and said, Vaginismus is an isolating monster. That's the best way I can describe it. It makes you feel alone in a situation that no one understands, broken and unable to be fixed, helpless despite countless attempts, and betrayed by your own body. You feel frustrated that while with every other situation, you are an extremely logical person. You just can't get your body to listen to you, or you can't understand what is going on. I, on my part, couldn't agree more. Jia, on the other hand, is a woman in her late 30s who was referred to me for infertility treatment. Jia and her husband of almost 2 years really wanted to start a family, so started trying to conceive shortly after the wedding. Jia had never attempted intercourse before her marriage. Whenever she and her husband attempted intercourse, they had to stop because it was too painful for her. She said that at first, they attempted more frequently. However, after many failed attempts at penetration, they gave up and stopped trying altogether. I tried doing a physical examination, but that was unsuccessful due to her pain, fear, and anxiety. Vaginismus is a condition affecting women where vaginal penetration for the purpose of intercourse, or gynaecological examination by her doctor, or pap smear, or any other such activity is either extremely painful or impossible. Vaginismus would not allow even superficial penetration, and the typical experience of intercourse is described like hitting a brick wall. Vaginismus can be primary, wherein the woman has never been able to have penetrative sex, or secondary, wherein the woman has developed this problem after maybe a vaginal infection or menopause or injury during vaginal delivery or one of those things. I once had a husband come and ask me if his wife is faking it. I did, of course, give him a piece of my mind, no doubt. But I guess this is an ignorance which exists amongst a lot many people, men and women alike. Vaginismus results from involuntary spasm of specific muscles around the vagina, which is not under the control of the woman. As Aparna said earlier, she's an extremely logical person otherwise, but during intimate moments, logic gets thrown out of the window and the body seems to have an odd control of its own. Why does such a condition occur? One is not very sure why this problem occurs, but several theories are suggested, both psychological and physical. To discuss the psychological aspects of it, I have here with me Mrs. Mansi Poddar, who's a psychotherapist in Kolkata and got her master's from New York University in 2009 and has been in the field for over 10 years. She previously worked with Bhagirathi with infertility and vaginismus. Hi Mansi, thank you for taking out time from your busy schedule and being here with me.
Hi, Dr. Rajeev. Thank you for having me in this conversation. I think it's such an important conversation to have.
Absolutely. Mansi, between you and me, we have dealt with so many women with vaginismus. And I'm sure in your career, you must have had so many more women with similar problems. I was just talking about the psychological background that could lead to such problems. Would you mind throwing some light on that, please?
Absolutely. So there are many reasons for vaginismus. I'm going to state a few that I've come across in my training and my career. And after having worked with a whole bunch of women, Dr. Rajeev, what I've realized is sometimes it's a personality trait. So some people are not very interested in sex. They just aren't sexually inclined.
Right.
So it's not a pathology in their case, but it's just, how they are wired.
Right.
Then there are a lot of messages around sex and gender, and I'm sure you also face this. Many of us have grown up to believe virginity is a virtue, sex is dirty. It impacts women's sex lives. So when we're thinking of sex from this lens of religion, morality, gender norms, we come across women who've been exposed to extremely traumatic ideas. For example, I remember, I grew up and I was told that if women enjoy sex or look for it, they are loose character.
Right.
So, as you know, character and sexuality is very deeply connected in our society. And this is one thing that really comes up repeatedly when I work with vaginismus. Ideas around sex, ideas around gender, cultural norms, religion. So, these external factors.
Do you think there is a possibility that because we don't have sex education in school, because we have this thing of boys school and girls school, and that boys and girls should not be mixing with each other, and all the children probably grow up with a very warped sense of sexuality. Do you think that might also be contributing in some way?
Absolutely, and that's what I mean by external factors and cultural conditioning. We are taught it's not okay to be with boys. So women grow up with very, very warped ideas around sexuality. Even men do, but in vaginismus we see this. And some other ideas and some other reasons that we see for vaginismus is, one is an idea that sex is painful. Second is lack of sexual education, which is what you just mentioned. Then we see a lot of childhood and sexual trauma. So if you've been molested in childhood or experienced rape or incest, these are things that do come up. And often on a couple level, we see there's a lack of communication and safety. And there can be other relationship issues contributing to vaginismus, but generally it is lack of communication and safety. Also, physically, women are not used to being sexually aroused. They've never explored their sexuality. They don't see themselves as sexual beings. So there is an identity issue. There is lack of sexual empowerment. Plus, on a psychological level, we see it can be OCD, it can be various phobias. So some women have a phobia of sex, they have a phobia of the penis, and all of this together leads to anxiety. And when I say anxiety, what I mean is when a woman is anticipating pain, especially sexual pain, she goes into a sympathetic nervous system response, which is a fight or flight response, and floods the system with cortisol and adrenaline. And this causes the muscles to tighten up further, and the relaxation response that we need to have sex is not present. So it's a body that often, in a way, I would say fails her, because that's the word that women have used. It failed me.
Right.
So I think these are some of the reasons.
So do you think there's also a reason, like, what a lot of my patients come and tell me that, in fact, from the women's side, there is a lot of dryness during intercourse and so on and so forth. And somehow the husband also always questioningly looks at the wife in the sense that, it's probably her fault. And then when I actually tell them that, look, foreplay is a very integral part of sexual intercourse and probably the most important part. And if that part is not taken care of, the intercourse is not going to happen well, because, the entire lubrication is going to come from the foreplay. So that importance being given to the women's sexual satisfaction probably not being there or not being given its due importance, and probably leading to more dryness, probably leading to painful intercourse. And then, as you said, that fight or flight kind of a response coming in, as a vicious cycle. So those probably also could be, playing in, I suppose.
Absolutely. And that's what I mean by relationship and couple issues. There is lack of communication. So a woman is not in touch with her sexual being. A man is not in touch with the woman's sexual being. They are unable to have the sexual conversation that is required for good sex. And in vaginismus, even if a woman is lubricated, often, like you said, there's a hitting of the brick wall that occurs. The body just tenses up upon penetration.
Right. Vaginismus being a complex issue, how do we doctors make the right diagnosis? So during the consult, we ask for a complete history and try and understand the exact nature of the problem. We try and ascertain if the psychological component is more or the muscular dysfunction is more. We then proceed for examination, wherein we try and understand the spasm of the muscles and gauge the severity of it. Does vaginismus have a treatment? And if so, what is the kind of treatment? So a complex problem like vaginismus cannot have a simple one-point approach. The treatment is a combination of psychological counseling, behavioral therapy, use of vaginal dilators, and use of medicines like Botox to relax the muscles around the vaginal area. Before I move on to explaining how Botox can be very successfully used in vaginismus, we must discuss the psychological aspect of the problem a little more. So, Mansi, when a couple comes in with vaginismus and you realize that there is a strong psychological component, how do you go about solving their problem?
That's a great question, Dr. Rajeev. It's extremely complicated, but what I do is I work with vaginismus on a mind, body, spirit, and couple level. So I am working with a client in individual sessions and couple sessions. It's very important for a partner to be on board with this. And on a couples level, we work with improving the relationship. We work with psychoeducating the man. We work with, say, a gynecologist like yourself. We work with a vaginismus expert, and we help the couple cope with it together versus individually. And destigmatize vaginismus with the man. That's super, super important that the man understands what is vaginismus. So that's work with couples. Now, individually, I start with sex education. I help a woman get to know her body, understand what is going on, understand what led to vaginismus, or at least help her destigmatize what's going on for her. And most importantly, I work with identity because I see that vaginismus impacts how a woman looks at herself, and work on helping her become more sexually empowered, which basically means that I work on her identity as a sexual being.
Right.
And we also work on unpacking the word pleasure, because pleasure is a large part of sex. So what is pleasure? How do we enable her to experience pleasure, both sexual, non-sexual? How can she befriend her body? Because in vaginismus, it feels as though the body has become the enemy.
Right.
So we work with bridging that gap and helping her befriend her body, understanding her body, stop being afraid of what her body is doing. So that's on a body level. Then we also work with women on a physical level where we teach them to use dilators. Now, why do we do that? Because we teach the nervous system who's the boss, who's in charge here, and help the nervous system relax a bit. It moves from red flag, no, penetration is scary, to okay, this is not scary, I've done this before and I can do this. And the muscles get retrained to understand that this is not painful, this is pleasurable. So it's very important for us to help a woman understand sex is pleasurable and not painful, and help the body train in that way. And when I work with women, Dr. Rajeev, I often recommend that they start doing yoga or some bodywork modality which gets them in touch with their body and pelvis muscles, because I see that there's a strong disconnect between the mind and the body in vaginismus. Mm-hmm. There are times when I've asked women that can you just focus on your uterus and your pelvis, and they'll tell me that I can't sense it, I can't feel it. So you can imagine how disconnected the body and the mind have got. And when we do bodywork modalities, including trigger point release, because muscles can be really tense, and that's where chiropractors come in, we focus on loosening the muscles in that region and helping people get in tune with it.
Right.
So yeah, that is how we deal with it, primarily emotionally, mentally, physically, and on a couple level.
It really works. I've seen that because I don't know if you would remember. I forget the name of that lady. She was a Caucasian working as as a missionary in one of the northeastern states. I think Guwahati, if I'm not mistaken. And she had contacted me over Skype, and we had a long chat. I particularly remember that she was having problems with vaginismus, and I had said that, look, unless you actually speak to the psychologist, I really wouldn't be able to help you, and it wouldn't be right for me to help you because you might be having a psychological component which I can't decipher. And only once you get the go-ahead from her should you come down to me for a Botox therapy. And in fact, I referred her to you. I think you did online sessions with her because obviously she did not come down. And she wrote to me later on saying that she was so happy and she never actually had to come down for the Botox. She got completely relieved from her problem by just talking to you and with the therapy that you did, even long distance, forget about she actually coming to you.
Yes, she definitely benefited and she did a lot of hard work. So there were times when she was really struggling and I would get messages from her, but it's important to have that psychological support. And most importantly, Dr. Rajeev, I really, to everybody listening to this podcast, I think that, vaginismus causes a lot of identity issues and emotional pain. And you absolutely must remember this is not your fault. And if there's one takeaway from my part, is that there's nothing wrong with you. You didn't choose this and you aren't any less for it. And that is really, really my message to everyone listening to this today.
That is such an important message to everyone, I'm sure, because I think everyone deep down within, they, as you said, somewhere blame themselves. They probably feel incomplete. They probably feel that they have not been able to give the right joy to their partners and feel bad about it, but they aren't any less for it. And probably this problem is like any other problem. And with the right kind of help, they should be able to overcome this.
Absolutely, I 100% agree. It's completely manageable.
Right. That was Mrs. Mansi Poddar, and thank you so much, Mansi, for that insight. Many of my patients owe a normal sexual life as well as their babies to you.
Thank you, Dr. Rajeev.
Thank you, Mansi, once again. Vaginismus, as I said earlier, is also about having tight vaginal muscles. Botox is a snake venom which, when diluted many times, is used brilliantly in solving many disorders like migraine, overactive bladder, and is extensively used in cosmetology for treating wrinkles and face contouring. Because Botox paralyzes muscles, it can be injected into specific areas of the vaginal wall, and this can result in beautifully relaxing these muscles. This done, vaginal dilators are put into use, and within no time, the couple can start sexual functions normally. This injection needs to be given only once, takes less than 5 minutes, and is not painful at all since it is done under sedation. The lady goes home in 2 hours and is back on her feet the very next day. This is an internationally accepted treatment for this problem with minimum or no side effects. Obviously, the next question will be, what is the success of the treatment? Success really depends on the involvement of the couple as a pair, as Mrs. Mansi also said, rather than on the woman as an individual. It depends on the proactiveness of the woman to accept and embrace treatment and come for the counseling sessions and also follow instructions as given from the clinic. By and large, success is almost 100% in most cases. However, long-term follow-up is required to ensure relapses don't happen. Living with vaginismus is like dealing with the world's most painful pleasure. In the end, it turns out well for Aparna and Jia, and it could do so for most of you. But for that, you need to speak out, accept that there is a problem, and be willing to seek help. And we are right there to help you all we can. This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. If you get a chance, do look up my website www.drrajievagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries. This podcast is available on Apple and Google Podcast as well as Spotify. Do subscribe and leave your comments and suggestions for any future topic on the Apple Podcast app. That's the only way we can make this better. Looking forward to great interactions. Keep listening.